Welcome to the DeFabio Difference, Health Management and Injury Prevention. Back pain, sciatica, the natural solution. I'm Jill Lally, and in our studio with me is Dr. Donald DeFabio. Dr. DeFabio is dual board certified in orthopedics and sports medicine. He is an international and national certified chiropractic sports physician. Welcome, Doctor.
Hey, thanks for having me here today, Jill. It's really exciting to be part of the DeFabio Difference.
Thank you. Back pain. What causes back pain, Doctor?
Back pain. A great question. And in reality, we kind of don't know what exactly causes back pain because there's so many structures involved in the back. It's very intricate. It can be anything from muscle aches and pains, a strained muscle, or there's ligaments in the back that can get injured. There's joints, right? The spine has joints in it, and the joints have to move between the individual vertebrae. They can get injured. There's nerves. Nerves can get inflamed. Nerves can get injured. Sometimes back pain is referred from other parts of the body, just like you can get arm pain, left arm pain from your heart. If you're having a heart attack, well, you can get back pain from your kidneys or sometimes from organs. Not very common. A majority, however, of back pain is mechanical, is from joints, muscles, discs, things like that. And 80% of the American population has back pain that's severe enough to go to the doctor. It's a huge problem.
And what would you do if they were to come and see you for back pain?
Look, Jill, the first thing that you have to figure out when somebody comes to the office, no matter what their condition is what's wrong? What's wrong? Comprehensive history, a thorough examination, standard physical, orthopedic, neurologic, functional tests. And then you have a working diagnosis. Is it a muscle spasm driving the pain? Is it an inflamed joint in the back driving the pain? Is it an inflamed or herniated disc driving the pain? Then, once we have a working diagnosis, we order tests if needed, blood tests, x-rays, CAT scans, MRIs, whatever we need. And then from there, we establish a treatment plan and move forward. So I don't know if that answers your question.
That's excellent. So it could be acute pain, chronic pain.
Yeah. I'm glad you said that, because acute pain means pain of sudden onset. It just happened. Mm-hmm. Chronic pain is pain that's been lingering for more than 3 months.
Okay.
And, the U.S. Department of Health and Human Services did a study, an analysis of best practices for the treatment of acute and chronic back pain. And, spinal manipulative therapy, chiropractic care came out on top.
So it's a safe alternative. And it's not an addictive alternative.
Oh, that's a whole nother answer. Yes. I'll say no, actually, because chiropractic can be addicting. It can be addicting to those people who want health, long-term health. And we can talk about that all day. Mm-hmm. But those are the people that choose to take periodic wellness care for health management, just like you invest in your 501c3 in your 501k or your IRA or your retirement fund on a daily basis, not because you want the money tomorrow, but you want it 5, 10, 15, 20 years down the road. Those are the people who get addicted to chiropractic, and they continue with a chiropractic lifestyle
beyond the pain relief.
Beyond pain relief. Hey, I get chiropractic adjustments every 2 weeks because that works well for me to keep me active. That's what my body needs. Everybody's different. And I eat right, and I exercise, and I do all the other lifestyle modifications that we talk about every day.
And then some of the treatments that you would use for the back pain?
It depends. It depends on what's wrong. We have, in my office, we do a multitude of procedures, things that are to help relax muscle spasm. So we use modalities. I'll use my hands a lot of stretching. We use a lot of different types of adjusting techniques. Some of the traditional lie you on your side and turn you up like a pretzel, but a lot when people are in pain are very what we call low velocity techniques, where there's very gentle, using gravity to realign the spine. We'll also do a lot of exercises, both with us in the office and at home. I'm big on home care. Hot packs, cold packs, braces for the back are very, very important. If it's the type of condition that needs something like that. And for management, I'm big with nutrition as well, lifestyle changes. Get up from your desk, all those types of things. If the disc is involved, that's a whole nother series of treatments, because a disc is a very different animal. But the disc is right by the nerve, and the nerve is right by the joint, so an inflamed joint in your back or an inflamed disc in your back can both hit that nerve, and those nerves go right down your leg, and that's when you get that traditional sciatic type pain.
So it's your accurate diagnosis that would differentiate the cause of that pain.
That's where it starts. It starts with an accurate diagnosis, then an established working plan. And research has shown chiropractic improvement or chiropractic treatments generally show improvement within 4 weeks, oftentimes 2. And then you move from there. If you improve, you continue. If you don't improve, you change and you do something else.
So then once they're out of pain, then they can move on to getting stronger
Sure.
and
Sure.
preventing that injury or...
That's a lot of times you have to be concerned about what caused the problem. Now, if it was an acute injury, well, yeah, don't fall again. But you have to make sure that there isn't any residual weakness in the area. Okay? If it's a chronic problem that's been developing because you sit for 6, 8, 10 hours a day, or you drive, or you're stressed, or whatever, or you have repetitive bending and twisting with your job, those need to be looked at, and then a rehabilitative corrective exercise program to neutralize, to balance the effects of everyday life, that needs to be incorporated for long-term correction.
So then in your consultation, you'll talk to a person about their activities of daily living, their lifestyle, their choice, and what could be contributing to that acute or chronic back pain.
That's huge. And look, I was taught that in chiropractic school 33 years ago, that you can get essentially your working diagnosis from a comprehensive history and consultation. And I still believe that. It really tells you what's going on. And now I can take that history and look at my 33 years of treating patients, and you see patterns. And that makes it even more efficient. However, I teach this to the doctors when I teach continuing education. You can't go into the patient like this. Okay, Jill told me she was bending and twisting and she got sudden onset back pain and it goes into her right butt. Okay, it's the L5 disc. I've seen it 100 times before. No, I know I've seen it 100 times before, but as a clinician, I have to remember your case may be different. I still have to go and cross all my T's and dot all my I's. And then I can say, okay, it's an L5 disc, let's move on. Or no, it's not. It's something else.
So if that L5 disc were creating that radiating leg pain, you would address it with a specific approach.
Yeah, just again, as I mentioned earlier, discs are different animals, okay? They generally do not like those high velocity types of treatments, but the first thing with the disc is you got to get the inflammation down.
Okay.
In fact, inflammation and pain drives just about all of our health conditions today. But you got to get the inflammation down. And we do that with diet, lifestyle changes, and safe supplements. So that's the way we address the inflammation right out of the box, okay? And then from there, there's our special treatments like decompression therapy, which is we use mechanical traction. Think of it as a mechanical traction. Very effective for discs. Or a manual flexion distraction therapy. And then we progress to rehabilitative care, and it's a difference between Williams exercises or McKenzie exercises, bending forward or bending back exercises. And if I can give a shout out to myself, I got a great video on that on my YouTube channel, so the viewers can check me out on YouTube. And it all talks about McKenzie versus Williams. And that's a whole different way to address the inflammation around the disc and for sciatica. It works really well.
So you have this integrative approach, looking at the patient individually, determining the protocols for them, and then using the essence of what you feel will give them that rapid result.
Very well said, Jill. I'm going to try to remember that. That was really good. Yes, it's the essence of their treatment that I want to get those results. But what's more important is that we watch the patient as they hit their landmarks of healing. And as they hit their landmarks of healing, their treatments will change in our office. It's not going to be, okay, we treat you this way forever. No, as you improve, we add more exercise, we change your exercise, we change your adjusting techniques, we change your home care recommendations, we get you off wearing the lumbar support belt, we modify things as you progress, and that also helps people get to the point where they can maintain their health and look into management of health rather than addressing sickness or disease or pain.
Those landmarks of healing are a great communication for the patient's understanding as well as measuring their success. So that's fantastic, Doctor.
Oh, thank you.
Thank you. When we return, we will be joined with Amanda Acapinti, a licensed acupuncturist, who will discuss acupuncture, and there's a point for it. Thank you.
It's a huge problem today. Opiate addiction, prescription medication addiction to prescriptions like Vicodin, OxyContin, Percocet. Those are highly addictive opiates. They're actually morphine derivatives. So much so that 1.9 million Americans are addicted to those prescription drugs. Just today, a patient came to the office with sciatica, showed me her prescription from her medical doctor for OxyContin. This is so much of an issue with the opiate misuse and abuse that March 2016, the CDC, the Centers for Disease Control, and the U.S. Agency for Health and Human Services issued a policy statement that doctors need to consider non-pharmacological alternatives and non-addictive medications for people with musculoskeletal pain. Chiropractic care has solid research that shows it's effective for low back pain, both acute and chronic. There's solid chiropractic research that is beneficial for neck pain and headaches. Check the Duke University study. Chiropractic has been proven to be non-pharmacologic and safe treatment for musculoskeletal complaints. That's what I do as a chiropractic doctor. So if you suffer with musculoskeletal pain, go to the chiropractic doctor first. The research is there, satisfaction results studies are high, and it just might be what the doctor ordered.
Welcome back to the DeFabio Difference, Health Management and Injury Prevention. Your response to the opiate epidemic, Doctor, is just so insightful. And really, when you think about it, there's an approach that is a natural solution to something that was not created naturally. So thank you. I want to introduce you to Amanda Acapinti. She is a licensed acupuncturist in New Jersey. She's a graduate of Drew University, summa cum laude, Phi Beta Kappa, and the Eastern Acupuncture School. She not only is a licensed acupuncturist, but also has a master's degree in acupuncture. Amanda, thank you for joining us. Welcome.
Thank you. I'm very happy to be here and excited to give some information about acupuncture because it's starting to pick up as a treatment for a variety of different conditions.
Would you please give us a brief overview about acupuncture?
Acupuncture is an ancient medicine that has different approaches. I personally take the approach where I try to assess what the root of the condition is, because no matter how much you treat the branch meaning any symptom that you may have, if you don't treat the root, the branch will never get better, or you may hit a plateau. So I'm always trying to figure out what the cause is, and it's not so much about what acupuncture treats, but how acupuncture treats different conditions. And if you're looking for natural, drugless, non-surgical care, then acupuncture might be for you.
So when someone presents themselves to you, we are talking about back pain. acute and chronic back pain, how would you approach them?
Well, you definitely want to look at the structures in the back. You want to assess the local area. But then beyond that, you want to ask them about different things about their lifestyle, about stress, about if they're exercising, are they sleeping, how's their digestion, do they go to the bathroom every day? Having a bowel movement every day is really important. And then all that information together, you can start to think about, what the root is, and then assess why they're having this back pain.
So the back pain could be a symptom of something else?
Absolutely. I see it a lot where actually not being regular in the morning can exacerbate people's back pain.
And they would never make that connection?
Maybe, maybe not, but that's the benefit of taking a different approach,
Right.
so that you can kind of put things together that you may not originally see would be fitting for one another. The other system that we use is we look at the meridian system. And the meridian system, although it was developed thousands of years ago, if you fast forward to modern day, it actually mimics the nervous system that we have in the science textbooks now. So there's actually a meridian pathway that follows different sciatica pain pathways.
Wow. Is that the key, the chi?
It's pronounced chi.
Chi?
It's spelled Qi, but it's pronounced chi.
Okay.
And chi is the vital energy source that we believe flows through the body. And when your chi becomes blocked, that can lead to different things like back pain. So in acupuncture, we look at trying to restore the normal movement of your chi so that the body can heal.
And then how do you approach the acupuncture once you identify what you're going to treat?
Well, we always want to do a very comprehensive initial assessment first.
Okay.
And then based on what we find in the initial assessment, we want to follow up with an appropriate treatment protocol. Personally, I approach my first treatments as if I would a training session, where if you come to me, we want to do just enough to start the healing process, but not too much where you come back and potentially we can't do as much. Similarly, like if we were to train together for the first time and I were to overtrain you, when you come back, if you're too sore, then we're limited to what we can do. Acupuncture has a gradual effect where every time you come, your body gets stronger and stronger. Your body starts to receive the treatment better and better. So it has a building effect, kind of like working out does.
That's a great analogy, Amanda. Thank you very much. What specific acupuncture techniques do you like to use?
I'm trained in a variety of different techniques, but one of the reasons why I chose the Eastern School was because they teach you 3 different styles: 5-element acupuncture, primarily 5-element acupuncture, traditional Chinese medicine or TCM, and Japanese style acupuncture. I incorporate all 3 of them with also some trigger point therapy, meridian therapy, because you can't just use one technique all the time, because then you're limiting yourself and then you're limiting your patient. So it's always kind of like, come in, we start from scratch, and whatever will work best for the patient, we include in their treatment.
That sounds fantastic. What about acupuncture is associated with using needles? So can you discuss that process for
Correct.
our viewers?
Yeah, so acupuncture primarily uses needles for treatment. You can use the acupuncture points and just use your hands in acupressure. But for my patients who are needle phobic, if you will, meaning afraid of needles, I use laser therapy. So we stimulate the acupuncture points with different lasers. Different colors do different things. Like green will harmonize, red will sedate or calm, and blue will, or violet will tonify. So depending on what is needed to be done in the treatment, we use different acupuncture points and then the different laser colors. So you can still receive the benefits of acupuncture even if you are afraid or don't want the needles.
And then are there varying length of time for a session in acupuncture?
It depends on the practitioner that you go see. Certain conditions require longer treatments than others. If you want to restore the body versus you want to reduce pain, you want certain treatments may be longer, maybe shorter. It all depends on really what you need that day. But talk to your acupuncturist about any concerns or questions that you may have about being on the table for length of time. For example, if somebody was coming in with back pain, you'd want to be concerned of having them lay on a table. Is that going to exacerbate their condition, or is laying on the table going to help their condition? Maybe they need to be treated on their side. Maybe they need to be treated sitting. I've had many cases where we can't even get on the table and they're just sitting for the first treatment. And then as they start to improve, you can have them lying on the table. So it's
Sounds-
great because there's not just one approach. It's
Right.
a lot of fun. Every
Just
time
so
somebody comes in,
comprehensive.
it's something different.
Yeah, and that you are taking that individual approach as that patient presents themselves. And like Dr. DeFabio said earlier, those landmarks of healing that you can adjust and then work with the patient as they are progressing, and you can train more, as you said.
Absolutely. And what's great about being at DeFabio Chiropractic and Sports Rehab is that I can go over to Dr. DeFabio and ask him questions, or we can bounce ideas off one another, or co-treat, which
you
is great.
co-treat.
Absolutely. Personally, the reason why I got into acupuncture was because I recognized the benefits of doing both, actually in the same visit. You don't have to do both in the same visit to get the benefit of it, but acupuncture is great at a lot of things. Chiropractic's amazing at a lot of things. So together, you're just allowing your body to get to a different level of healing and functioning.
That sounds fantastic. So it's really a coordinated, integrative approach.
Absolutely.
And the patients feel the difference, and they see how the synthesis of that coming together.
Absolutely.
What about ages of patients and levels of fitness of patients? Does that all have a factor with?
Any age can receive acupuncture treatment, just like any age can receive chiropractic. I've been adjusted as an infant. I've seen infants be adjusted. I've seen the geriatric population get adjustments and get acupuncture treatments. With the younger age groups for acupuncture, I always go for laser first.
Okay.
But if they have the constitution and they're healthy, then you can think about doing acupuncture needles. But for the younger generation, I always, under 13 approximately, I think about laser acupuncture before
That's a
using
very
needles.
thoughtful approach to really meet the needs of a younger individual. Is there any underserved patient that would really benefit from learning more about acupuncture?
Well, acupuncture can't hurt.
Right.
So even if you're not sure if it's going to work, you're not taking a medication that you don't need, you're not getting a shot you may not need, you're not having a surgery you may not need, it really it can't hurt to try. So even if it may not be for you, you may find out that it is.
That's really a wonderful analysis and way to
Thank you.
approach your patients, really. Do you feel that you talked about the digestion and the colon and being irregular for back pain? Do you see other conditions that present themselves that could affect their back?
Well, personally, when I talk about thinking about the root versus the branch
Right.
and really assessing, underlying issues that could be contributing to any symptom that they may have, first things first is we look at digestion, because if you aren't absorbing and then getting the energy that you use to the cells in your body that do the work, like healing, because healing the body requires work, it requires energy. So if you can't digest and absorb and send that food we call it gu qi, to your body, how can you heal? So that's the first thing we kind of want to address. After that, we want to talk about elimination, because if you're not eliminating the waste that comes from after your cells take up all that it needs from the nutrition, and if you're not eliminating those toxins and they stay in your body, how can your body heal? And then after that, we look at sleep. Because if you don't sleep, your body can't heal. We know that when we sleep, our body releases different hormones and different neurotransmitters that promote healing, tissue repair. And then after that, we look at your energy, because if you're not having energy throughout the day, then that can also impact your body's ability to heal. Or you can't do the corrective exercises that we do in the office because you don't have the energy to do it, and that can also influence the healing process for any condition, whether it's back pain or anything else.
Well, that's a brilliant assessment of going through to address and target each individual and strengthen the foundation. Do you feel that, like Dr. DeFabio will incorporate supplements? Is there a time when you might offer your patients supplements?
Absolutely.
In that process?
And going back to the concept of getting the body to do work, healing is a working process. So if you don't have the nutritional resources, and maybe you're not eating enough macronutrients, protein, carbs, carbohydrates, and fat, maybe you need a specific vitamin, maybe you need a specific mineral, maybe you need something to tie it all together. Maybe it's a probiotic. Gut health is really important. So you definitely want to incorporate nutrition via supplements if the patient needs it, if they're not progressing as quickly as you would anticipate.
Is smoking a problem or anxiety a problem when you're seeing patients with acupuncture or their back pain or any other condition that they might, do those affect their response?
Yeah, when patients are stressed, we know can affect
Smoking's a
the
huge
whole,
problem.
Yeah.
Smoking's a huge
It's a
problem.
huge problem. But now acupuncture, I'm sorry to interrupt.
No,
I
thank you.
apologize.
Thank you.
I apologize. But
Well, it slows the healing response,
yeah,
doesn't it?
it shuts off oxygen supply to your body. It's a huge problem. But anyway, acupuncture, you can stop smoking with acupuncture, right?
There's a protocol that has been established. It's called the NADA protocol that you can use for smoking cessation.
Yeah, that's the key. It's about lifestyle management.
Lifestyle management. So you want the health management and the injury prevention for the tissue repair, and then living a better way, stronger way. Do you like to co-treat, or do you prefer to see patients subsequently, one and then the other?
We love to co-treat. It's really great for the patient, but the order in which they get their adjustment first or their acupuncture first, it depends on the patient's schedule. It does depend on the condition. There are sometimes when having the alignment being set first via the adjustment and then having the acupuncture afterwards to kind of relax is great, or needing the tissues and the muscles to relax, and then really being able to get in there and provide a deeper adjustment. So it depends. It goes case by case.
Again, that case-by-case integrative approach. And I want you to remember that when I is replaced with we, illness becomes wellness. So when you invest in your health with the DeFabio difference, you will have health management and injury prevention. I'm Jill Lally, and thank you for joining us.